I'm going to ask you just a few questions and yield to my colleagues, and I'll ask them all, and if you could just then respond to them. One of the biggest takeaways we had from our trip was debris. There was debris everywhere. It was a story to two-story high. It looked like there was a lack of capacity or capability to remove it. And I know that there are some cash for work programs that Catholic Relief Services and others are doing. When we got hit on, and I'm wondering if that might be one job that they might undertake, because, I mean, the dogs, the rodents, which will proliferate diseases, including leptospirosis, which could easily erupt as a major health hazard. But when we got hit by Superstorm Sandy in New Jersey, and a lot of my shore towns were unbelievably negatively affected, we had debris everywhere. But thankfully, we had functioning mayors and town councils, the ability of the sheriff, who was the Office of Emergency Management leader in Monmouth and Ocean, and they did wonderful jobs in coordinating the debris removal and environmentally safe depositing of that debris. Our takeaway, I think, collectively was, what are they going to do with all this stuff? It's everywhere. And I wonder if you might want to speak to that. Secondly, on the issue of trafficking, as you know, I'm the prime sponsor of the Trafficking Victims Protection Act and work on combating human trafficking every day. We're all concerned about, now that the recovery efforts, now that the roads are all open, or most of them, that the traffickers, including women who have made their way to Manila and children, may look to prey upon vulnerable people who, over a longer period of time, may have lost some hope or may be very gullible for an offer to go to Saudi Arabia or to Korea or somewhere else in Saudi Arabia, in the Philippines, for what looks like a real job, but turns out to be an engraved invitation to a hell on earth, which would be a trafficking situation. I understand there's one protection person on the response team. Is that enough? Has the tip office been brought into this in a robust way to apply every best practice they know to mitigate human trafficking? Third, we learned, and this is a minimum estimate, I think, 90,000 pregnant women. My understanding is that there are some estimates that put that even higher in the affected areas. I know that the availability of safe blood and a venue where a woman can give birth who may need a C-section is a very real, compelling need. And most, as I said in my opening, of the health clinics have been destroyed or very seriously damaged. And I'm wondering what the plans are to ensure that as these women, especially in the final 3 months of pregnancy, get close to birth of their children, will there be an effort to ensure that there is safe blood and a skilled birth attendants to, again, save her life if she needs a C-section or some other help to help mother and baby. I would note parenthetically that my own daughter-in-law, my wife and I are parents of grandparents of three grandchildren. Just in July, in a Princeton hospital, had an emergency C-section, lost 2 liters plus of blood, and they had to send out for some of it because they didn't have her blood type. They had some, but not enough. And in a ravaged area that we visited, and you visited as well, with no health clinics that are working, that could mean death to a woman where availability of safe blood could mean life. So if you could address that. And finally, the issue of best practices learned from the earthquake in Haiti and the tsunami in the Indian Ocean. I actually was on the Abraham Lincoln briefly with a group of members. We went to Banda Aceh during the tsunami. And again, the deployment of the aircraft carrier was like a pivot, an anchor for relief efforts, particularly during the emergency phase. What other best practices have been learned that are being applied now as a result of the typhoon?
You've raised a lot of the critical issues. So first on debris, it's amazing. I mean, it reminds me of the snowbanks of my growing up in Minnesota where they tower over you. This is a critical issue. The government of Philippines has a salvage first policy. And so you may have seen as well, people are already starting to pick through what's reusable versus what needs to be put into a landfill. We are taking this into account in designing our transitional shelter programs and also incorporating what we call cash for work as a part of our programs, working with our UN and our NGO partners who have a lot of skill and experience in doing programs that basically provide a day's wage in return for clearing debris away. This will be a huge challenge, an important challenge. Unfortunately, or fortunately, the Philippines actually have a fair amount of experience in dealing with debris. It's a scale issue in this instance, and it will be an area of immediate focus as we look ahead. You've raised some of the other associated concerns about disease with the debris, and for that reason, the fogging is a very important approach because there's standing water. The other issue, of course, is that there's still pulling bodies out from underneath these mountains of debris, and that will likely remain an ongoing effort as they work their way through the recovery. On trafficking, this has been an area of concern in the Philippines for some time, and in fact, the United States has put about $11 million into counter-trafficking programming in the Philippines, and we work very closely with something called the Philippines Interagency Council for counter-trafficking. There is a need to remain very vigilant about the possibility of increased trafficking. Whenever you have a major disaster like this and people are newly vulnerable, there is the potential for increased trafficking. And so for that reason, we are watching this very closely, working with the local partners who we work with all the time, and looking to see where and if and how we need to increase the programming that we already have in the Philippines. And we are talking very closely, working with our CTIP partners. So thank you for your support on that. On the pregnant women, you know, the whole issue of the cold chain is critical, not just for pregnant women, but for the immunizations that have to go forward. So that's a priority between WHO, the government of the Philippines, and UNICEF. We've provided support for that to get the cold chain back up and running so that you are able to bring forward critical medicines, including blood. There are right now 184 medical teams on the ground. There's been a fairly robust international response to try to fill the devastating gap that the storm created. And they are now operating in the affected areas, working to reestablish those critical facilities. Also importantly was the early evacuation. I mentioned I rode in on a C-130. Our U.S. military C-130s, as they carried supplies in, they carried people out. And about 12,000 people were evacuated, and the hope is that those who need that kind of specialized assistance, including some of the more complicated births, are able to get out. Finally, in terms of best practices, you know, I think there were a lot of important best practices that we took forward from past mega disasters. And one, it really resulted in the close, very effective collaboration between USAID and the DoD. And we were able to, because of the work that we'd done together previously, very quickly stand up an effective air bridge that prioritized the most important life-saving supplies that to go forward. One of the things that happened in Haiti is there was a clogging of supplies that went through the system, and sometimes not the most important supplies went first. So that the seamless collaboration that was a hallmark of this effort really grew out of the lessons from Haiti.
Not to make light, but I did bring up fogging everywhere we went and pointed out that when I was 7, 8 years old, without any parental notification or consent, my friends and I used to follow the fogger in Island, New Jersey, and on our bikes. So the ability to reduce the impact of dengue fever and some of the other the mosquito-borne, vector-borne diseases that are looming, the attendant risks that fogging might bring, I think the risk versus the benefit of stopping several epidemics from bursting out I'm so happy to hear that because I have never seen, and I think my colleagues, Mr. Green and Mr. Franks would agree with this, have never seen more standing water putrefying than we saw as a result of this typhoon, which obviously is a breeding ground for vector-borne disease.
Well, as someone who also followed the fogging trucks when I was growing up, but in fact, there is a great concern about not just trying to address the standing water, but also to revitalize the surveillance system, the health surveillance system, because one of the concerns is in the wake of the storm that we need to very quickly have the ability to identify where you have an outbreak so that you can do the fast treatment. So it's really those two actions, the surveillance system and the preventive fogging, that are underway.
Thank you so very much. Mr. Green.